Are you revising for the UK MLA examination and find questions that have radiology images particularly challenging? Single Best Answer is the platform for you. Not only can you customize your revision more than any other platform, it has the areas of clinical practice laid out exactly as the GMC MLA content map has it. So here you can click on clinical imaging specifically and do questions here to sharpen those radiology skills. I'm Ziad, and today we're going to do a question with a radiology image included to help you practice. So let's try this question here. A 32-year-old man has a motorcycle accident. He is agitated and has bruises on the side of his head. Primary survey identifies likely rib fractures, but no pneumothorax or tamponade. He is intubated and stabilized before undergoing a CT head. At this point, I'd recommend taking a look at the CT image without looking at the options that are available. Otherwise, that could distract you and lead you down the wrong path. So looking at this CT head image that we have, we can see that there is an area of white, bright white on the right side of the image. And this signifies an acute bleed. Blood looks white on a CT head when it's acute. And that fits with the trauma history that we have in the question. We know from the question that there are lots of injuries that this patient has sustained, and it is unsurprising that there is a head injury with a bleed consistent with that. Next, we think about what the shape is of this bleed, and here it looks concave. The significance of concave is that it tells you that the blood is trapped between two tough surfaces. Here is where we have to think about the different layers in which the bleed could occur. If it was happening beneath the skin, it would be outside of the skull. This is within the skull because we can see that the skull, the very white bone, is on the right side of it, so it's on the outer curve of it. Then there's the extradural space. The dura is quite a tough material, and if the blood is trapped between the skull, which is hard, and the dura, which is really tough, then you end up with a concave shape, and this is what extradural hemorrhage looks like. Beneath the dura is the subdural space, and this tends to look more spread out and diffuse, if you like. Intracranial bleeds tend to be within the brain parenchyma, and subarachnoid you would see the blood within the ventricles, which is where the CSF is. So looking at this image, we can see that there is a concavity, and therefore it must be an extradural hemorrhage. Now let's look at the options available. Extradural hemorrhage, intracerebral hemorrhage, subarachnoid hemorrhage, subcutaneous hemorrhage, or subdural hemorrhage. Let's click on the answer that we think is correct, which is extradural hemorrhage, and indeed that is correct. And if you look at the bottom, there's an explanation here, and that this patient requires urgent neurosurgical intervention. Now, the key thing is this question satisfies what we call the cover test. You can answer the question and look at the image and know what it's asking without looking at any of the options. And Single Best Answer satisfies that. All the questions we have satisfy the cover test, which is typical of the MLA exam. So if you like this question and would like to revise some more, then head over to www.singleBestAnswer.com. Good luck revising.